Okay, the next patient case, what I want to talk about, we use very commonly with the NuStep is strokes, okay, or CVAs. I want to go through, one thing I did forget to mention, with a stroke person, I usually wouldn't do this, but someone higher level, these simply get up out of the way. You don't have to rotate the seat all the time. It makes it easy to get in and out of. In here, sometimes these get in the way anyways. I like to flip them out of the way while they're working it, if they have a cast on this protruding elbow. Okay, but getting back to the stroke patient, the nice thing about this neurologically with some of the stroke, or one side's involved, the other side is intact and healthy, is a reciprocal motion. Okay, and that's what we want to get moving, get the body back in tune with itself using reciprocal motion. Okay, right and left arm, or right leg, left arm are working with each other just as they are when they're walking. Okay, so it starts the whole pattern going in the right direction. Say if it is the right side that's involved, there are oftentimes in a stroke you'll have either a flaccid arm, and we want to keep it ranged, so then we'll fasten the hand to here, whatever means you can, and we're going to work that back and forth so it doesn't get tight. I had one person who had a stroke. She was about 3 months out. It actually started to contract, okay, and get the contracture, and we actually used it for a stretching device. We're going to put her on, we'd fasten the hand here. She actually had a little grip, and we would just stretch, and she'd work it slow, stretching it out, and then she'd come back this way, stretch it this way, and it worked so much better, just like with the knee. She was in control, she was more relaxed, and the benefits were much better as opposed to a passive range of motion by a therapist. Same thing in the leg, the same concept as far as stretching, bringing the knee up, okay. It does not stretch on the way down unless you have the foot fastened to the foot plate if it is a flaccid leg, okay. Again, legs only, working just that leg, focusing on the leg. We can go arms only, okay, and it works out well. We can look at the numbers. Again, typically in this case, I'm not too concerned about the higher level setting goals. We're just working on function. When they see the gains in their function, that's plenty of reward and gives them motivation to continue to use the equipment that's doing the work for them. Thank you.